Meet Heather. She is a new principal at Edison Elementary School. She wants to develop an inclusive learning environment for all students, including students with disabilities. However, she doesn't know what Duchenne muscular dystrophy is. Duchenne muscular dystrophy, or DMD, is a genetic disorder that is characterized by a progressive muscle degeneration and weakness. It's one of the 9 different types of muscular dystrophy, and it's the most common. In normal individuals, a protein called dystrophin connects the cytosol of the muscle cells to the extracellular part of the muscle cell. It's part of a larger system called the dystrophin glycoprotein complex, or DGC. The DGC provides structural support to the muscles and allows them to recover after injury. In an individual with DMD, however, there's a genetic mutation in the dystrophin gene, which provides non-functional dystrophin proteins. This then reduces the functionality of the DGC and reduces the structural support. DMD individuals are more prone to muscular injuries. DMD is the X-linked recessive gene, which means that it primarily affects boys. It affects about 1 in 3,500 males, or about 0.003%. As of now, there's no cure for DMD. Heather asks, what can we do in education? While the information may be terrifying, there are practical steps that schools can do to mitigate the struggles of DMD students. The first step is to adjust your classroom to be accessible for DMD students. Most DMD individuals have an impairment in their ability to walk. This includes an increased frequency of falls and injury. On average, DMD individuals lose their ability to walk by age 12. This means that they rely on different types of mobile assistance, like wheelchairs to scooters, for walking. Schools should reflect these needs. This includes appropriate entry and exit to classrooms. There should be wide doors and guardrails, and they should place their classrooms on the first floor buildings. Instructional teaching should be all in one room. If that's not possible, reduce the amount of walking between different classrooms. The second step is to advocate for increased funding on supplemental educational material. Having an additional set of textbooks that the DMD student can keep at home reduces the weight of material carried back and forth to school. What seems like a trivial task for normal students can be a physical burden for DMD students. DMD patients typically have skeletal deformities. This includes scoliosis. Additional weight from classroom material can expedite these deformities. In addition, DMD students can also lose fine motor skills as they lose muscle strength. This means that conventional writing and note-taking on paper may be unfeasible. An alternative would be computer technology that utilizes voice command/dictation, which can mitigate the barriers of learning. The last step is to play an active role in the individualized education program. Individual education programs, or IEPs, outline the goals of what is expected to be learned and achieved in the coming school year for the student. Some states may call it the pupil evaluation team, the multidisciplinary team, or the admissions review and dismissal team. It is made up of several members, including the parents, school administrations, PE consultants, and licensed physical therapists. It must be reviewed once every year, and the child must be reevaluated every 3 years. But because of the nature of DMD, the children's cognitive functions may decrease rapidly within 1 year. As a school administrator, you should be in constant communication about the school's curriculum goals and resources to the parents should the child fall off the IEP. Wow, I didn't know that there were so many educational barriers to DMD patients. It's no easy task, but at least we could provide the means and access to a quality education to those with DMD. For more information, check out the Muscular Dystrophy Association website here.